ago, I was asked to come here and talk to you and enlighten you as to the superclusters, the great life sciences health supercluster that was being created by the government. And we found out about a week before I was supposed to get on stage that there was no such thing, that it didn't happen. So I had to kind of make something up on the fly. I think I survived, surprised I actually got invited back. And now I got to get up on stage and sort of explain to you why the glass has to be half full, why it's important that you invest. And God knows, as a Montrealer and an Ottoman now, why, if one of our reasons to invest in Canada is if the Leafs have to win the Cup, that this is indeed a long, dark winter ahead of us. So I'm going to do my best to explain why it's important that there is investment, not essentially just from a company standpoint in the sense of infrastructure, hiring people, and being part of the health system, but there's another reason, and I think Brian Bloom talked a bit about this in the panel earlier, and I'll touch upon a couple of his points. Pamela referenced the HBEST, which is the Health Biosciences Economic Strategy Table, which in this world of ashes was a bit of a rising phoenix. It came out of the innovation agenda from the government. It brought industry together with some of the key people in government to try and sort of identify a path forward for Canada's health sector and biosciences sector. And it made some, I think, very important recommendations. And I'm going to highlight a couple of them, which I think are really important for the purposes of this morning. One is that it set out a couple of key objectives. One was to sort of take the number of companies we have in Canada, the small biotech companies, and grow them. I think we're at about 900 now, and they want to double that and grow them to 1,800. And in that category, also identify some what they call high-value companies and grow those high-value companies. And the whole point of that is to ultimately get to a place where you've created something called an anchor company, or anchor, if we're really lucky, anchor companies. My colleague Brian is here from Novo Nordisk, and I know he's fond of talking about Denmark, a population of 5 or 6 million people, and they have 3 so-called anchor companies, one of which, of course, is Novo Nordisk, which, if you know your Canadian history, is actually a Canadian company that the Danes stole from us. But we still love Brian. So what are we trying? We're going towards anchor companies. And if this is going to work, there we go. I'm not going to explain the cryptic reference there for you millennials. You can figure that part out. But those of you that are my vintage, you'll understand what the Acme and the Coyote means. So we're trying to build companies in Canada that are going to be globally competitive. Well, what are the building blocks of these companies? You've got some very key components. You've got your drug discovery. You've got to come up with something first. You have to find your partners. You've got to get your talent. You've got to get your investors. And you have to find government and the government policy. And I think a couple of slides earlier that Peter had on sort of really showed, and also Pamela's slides show exactly where the government sort of intersects with the industry. So if you put all these things together, you might be able to create a company. And so if a company put it all together, and let's be somewhat imaginative. I'm going to say maybe we get a company that figures out that there's a protein in the mosquito that carries the malaria virus. And maybe that protein can be sort of, because there's something odd about how that behaves in women, it can be used to attack cancer. And so that comes out of something called the CDRD, for instance, which is the Center for Drug Research and Development out in Vancouver, or could come out of Mars Innovation here in Toronto, CQDM, Iroquois in Montreal, any one of those organizations, Neomed as well. And maybe they're able to go out there and find the people they need to run the company, so the PhDs, the talent that they need to run the company. They then go out and look for investors. They find the investors. Maybe Brian Bloom's company sort of kicks things off a little bit, finds the seed capital and gets them going, up and running, and then they've got to find some partners. And maybe they get lucky and they find a company like Celgene to sort of take a shot at them and really partner out with them and get them going at their very early stage. And then they take advantage of a number of key government programs, SR&ED tax credit, maybe the IRAP program, which provides them this early stage funding. And you kind of get the genesis of a company. And then as they sort of grow, maybe they find some other partners like Lilly and Johnson & Johnson, and Celgene again comes back in, and Janssen and GSK and Merck, and maybe even Leo comes in. And so if all of this starts to sort of look like a pipe dream, I'm going to let you know that it's actually not. Because Acme Biotech is a company called Zymeworks out of Vancouver. It is now up and running, has about 145 people in its employ. It's just opened up a 10,000 square foot lab space in Vancouver. It's got salaries in the range of 100,000 plus. It's listed on the NASDAQ. And all of those companies that were on the slide earlier are all partners, including Leo, which I think just came on board in the past couple of days. It's a really exciting company, really exciting space to see moving forward. But as I said earlier, one of the key things about this is it requires some very special investors. It requires these partners to come in. And that's where the changing pharma model becomes a really important factor. I don't think we've got a Zymeworks here unless the pharma business model changed fundamentally globally and they became partners and investors in this. As Brian talked a bit about before, the investment space out there is really complex in the biotech world. It requires a very special investor. If you've got a teenage child, more likely a boy than a girl, but if you have a teenage boy, you know that there's something out there called Fortnite, because your child is a zombie. And I looked it up. I was kind of curious to know about Fortnite. Fortnite took about 7 years to develop, $225 million to fund it. In its first year of operating, this is a free game, by the way, if you're not aware of it, it's a free game. It generated $1 billion in revenue. It doesn't take a really sophisticated investor to figure all that stuff out, especially if they've got a teenage child. If you don't have if it's not a teenage child that's enraptured with it and it's older, your child is older, then maybe the panel earlier is where you should be focusing your efforts. But it does require a very special investor. They're not out there. The ordinary investor that's sort of really looking at the small types of tech IT stuff. It really needs somebody who understands the space, is willing to take the time risk and also put the money into it and understand the inherent riskiness of most of these ventures don't actually succeed and go forward. And when you look out at the Canadian space, I used Zymeworks as an example, but there are a number of other really exciting companies, and certainly in the BIOTECanada membership, that are growing very, very rapidly. And I think what's really interesting about that is I put them down on the left side of the slide, and then you look on the right side and you see all of the partners. And this is where the whole idea of this sort of the organization whose name we cannot speak comes into play, because as you saw some early slides and some of the panels from this morning, this is creating great uncertainty out there in the marketplace. And unless we take on a more holistic approach to government policy, it will put a chill on investment in this country. We will lose these partners and these investors. And I think the reality of that is if what we're really trying to do is grow the number of companies and create anchor companies that are globally competitive, that work and live and breathe here in this country, our chances of success are highly unlikely if we don't have the pharma industry as a really central part of the biotech ecosystem. And when government is making policy, this is the one area they have to be very cognizant of. If they are not, if they go ahead, and it may be easy to beat up on pharma and hate pharma, it may feel good in the moment, but I think the long-term consequences are dire, not only for Canadians from a healthcare standpoint, but I think from an economic standpoint. We're going to miss out on what is a really exciting opportunity. We're developing great companies. We have phenomenal innovation coming out of our research centers, as was alluded to on the earlier slide. And we can turn these into companies, but we can't do it without the pharma investment and partnership that is so essential to driving these companies forward. And that's why, in my mind, if we don't get it right, we're resting on the shoulders of the Maple Leafs, and we've got a real problem on our hands. I thank you again for having me back.